we're seeing community spread, usually linked to either families or large gatherings. So I'd just like to remind people that it is important when anybody's sick to self-isolate as much as possible, frequent hand washing, cleaning surfaces, even with just a generic brand antibacterial wipe, or if you don't have that, since they're in short supply, 10% bleach, 1 cup in a gallon of water. 1 cup of bleach in a gallon of water is an effective sanitizer. And bleach is readily available today, which is nice. Just last week, we had 7 positive tests in one day. So it's still out there, it's circulating. Whether it's a danger to you or not, if you catch it, you can still spread it. So just try to keep up the good work on social distancing, mask wearing in public. Also outside, if you're in a gathering where social distancing isn't possible, barbecue or party or even at the beach, if you can wear a mask, that'll help reduce the chances of you getting it or spreading it if you have it. Well, the official start of flu season is September 1st. We don't normally see influenza that early. It usually starts about late October. But we start tracking influenza-like illness on September 1st for the CDC. And the problem is this year, normally what infection preventionists do is we watch the Southern Hemisphere, because right now is their winter. That is their flu season. So normally I can look at, say, hospitalization rates in Australia due to influenza, and I can have an idea of what kind of flu season we're going to have. This year, nobody's really reporting on influenza. Everything's focused on COVID. And while that is super important, it makes it kind of mysterious to us because we really have no idea what the flu season is going to look like. So because of that, normally every year we ask that people get an influenza vaccine anyway, but this year it's super important because we really have no idea what's coming in the way of influenza. And until it gets here, it could be a super bad year, like I think it was 2016, 2017, or it could be a relatively mild year, like last year. We really have no way of knowing. So any protection you can get will definitely help protect you against influenza, where if you do catch influenza, you may get a milder case, or you may not even know it. The problem is that an influenza vaccine is not going to protect you from COVID. There's no COVID vaccine yet. They're still working on it very hard. But you can get COVID and influenza. And as a matter of fact, people aren't really aware of this, but you can actually get influenza A and influenza B in the same flu season. That would be a terrible, terrible winter. But it's possible. So it's super important to get a flu vaccine, especially if you're in the COVID danger zone. Like I said, it's not going to protect against COVID, but if you're weakened from influenza and exposed to COVID, it could turn out worse. You could have COVID and influenza at the same time, and that would put you in extreme danger. So we're actually looking at, we don't have the vaccines yet, they're being shipped for influenza, but we're looking at how are we going to do that this year in the time of COVID. We can't have mass vaccination stations like we've had in the past where everybody just shows up and runs through. So we're talking about maybe having drive-up vaccinations, using the shed outside, maybe something like we did with the public health COVID testing, if the college has that garage available. We're just looking at how can we safely vaccinate as many people in as short a time as possible. Well, for an appointment, you can always just give us a call, 712-852-5500. You can follow us on our PACHS Facebook page. We try to put out updates as often as possible and immediately if something changes radically. You can also go to our website, patches.com. There's also cdc.gov. They have great coronavirus information for public and businesses as well, if you're interested in protecting your business, even more than maybe you already are. And then the IDPH website also has some really good information tailored to Iowa.